Hello all, today we are going to talk about the topic lung carcinoma. Okay, so we know carcinoma means something related to cancer. Okay, so in our lung there is a uncontrolled cell growth in the tissues. Okay, so uncontrolled cell growth in tissue of the lung. So it's happening in the carcinoma. So if we don't treat the cell growth, then it can spread beyond the lung. Okay, and this process is called metastasis. Okay, so it spread beyond the lung. Even it can spread into the other parts like heart, diaphragm, other parts. Okay, then come to the epidemiology. Worldwide, lung cancer is the most common cancer that causes death. Okay, uh, okay, then come to the signs and symptoms. Okay, so if the person has a lung carcinoma, okay, then some of the symptoms are shown to him. Okay, first, dyspnea, uh, which means difficulty in breathing. The person may have the shortness of breath. Then hemoptysis, when he cough, blood will come in the cough. Okay, that is hemoptysis. During cough, some of the difference he can notice. Okay, normal coughing pattern is not come in this type of person. Okay, then wheezing may occur. Then there is a possibility of chest pain or pain in abdomen region. So these like pains are happen. And cachexia, which means weight loss. Okay, weight loss. Fatigue may occur. The person has a loss of appetite. They don't have any hunger. Okay, that is a loss of appetite. And dysphonia, their voice will be changed. Okay, hoarse voice, like that voice will become. And the clubbing of the fingernails. Okay, it is uncommon, but it also happens. Okay, then dysphagia, difficulty in swallowing will be happen. Okay, so these like symptoms are happening in the clients. Okay, then come to the causes. Okay, first major cause is smoking. Okay, particularly cigarette. Okay, and also it has two type: passive smoking and active smoking. Passive smoking, so it's the inhalation of the smoke from the another smoker. Okay, so the person going to inhale only the smoke. So this is for the passive smoker. Here what happened, nicotine going to stop the immune response. Okay, so that it enhance the abnormal growth. Okay, abnormal other type of growth of the cells. Okay, so if the tumor is growing, no one is here to ask question. Okay, the immune system is not going to respond. That's why it developed. Okay, then come to the radon gas. Okay, radon is a colorless, odorless gas. Okay, so it is obtained from the radioactive element, radium breakdown. Okay, so these radiation exposure is also one of the cause of the cancer. So it's going to affect the genetic material. Okay, by these mutations are occur, so that it going to form the, sometimes it can turns into the cancerous. So it is a second major cause. Okay, radon exposure. Then come to asbestosis. So it is asbestos. It is our, in our home we have a roof like this. Okay, so this is one of the type of roof which contain the asbestos. Okay, it is a cause of the variety of lung disease including lung cancer. Okay, it also causes the pleural cancer. Okay, so we call it as mesothelioma. Okay, mesothelioma, it is a pleural cancer. Okay, it is different from the lung cancer. Then some of the viruses. Okay, viruses are also causing the carcinoma of lung. Okay, so in this human papilloma virus, JG virus, BK virus, cytomegalovirus, so these like viruses are playing major. and particulate matter. So exposure to the particulate matter is also responsible for the cancer. Okay, so which means in air some of the concentration are increased. Okay, then it's going to develop the lung cancer. Okay, that is a particulate matter in the air. Then come to pathogenesis. Okay, so first it is a oncogenesis process. Okay, so oncogenes are the cells it going to suppress the tumor. Okay, it is a normal process, so they are the tumor suppression genes. Okay, in this cancerous process it going to be inactivate the tumor suppression skills. Okay, so which means if the oncogenes are arrived, okay, if it is increased, then the tumor suppression genes are absent. Okay, inactivation of the tumor suppression genes are arise, and it's going to lead to epidermal growth factor receptor. Okay, so this factor, okay, epidermal growth factor receptor is responsible for the proliferation and apoptosis, which means cell death. Okay, and angiogenesis and tumor invasion. So for these all, epidermal growth factor receptor is responsible. If there is any mutation in this EGFR, also lead to the abnormal cell growth. And some of the other causes like chromosomal damage or any genetic polymorphisms. So these also lead to the tumor suppressors gene damage. Okay, so particularly chromosomal damage is going to suppress the tumor suppressor genes. Okay, it's going to inactivate it. Okay, so chromosomes like 3p, 5q, 13q. So these are all lead to if these are all damaged, then it lead to small cell lung carcinoma. Okay, then come to the diagnosis. Okay, so in this we just do the chest radiograph. Okay, in this we look for the any obvious mass of cells are there. Okay, or any widening of the mediastinum is there. Okay, or atelectasis, which means any collapse is there. Okay, or any pleural effusion, any consolidation, like that we have to notice in the radiograph. If the person has a sputum with a blood stain, which means in their sputum some of the blood is there. Okay, but the radiograph is showing normal, then we have to move on to the bronchoscopy. Okay, radiograph normal, then we should go to the bronchoscopy, CT scan, CT guided biopsy. Okay, guided biopsy. So by this we can find the tumor type also. CT scan, guided biopsy. Okay, then sputum cytological examination. By this we can diagnose it. So when come to the different diagnosis, the chest radiograph may also shows the symptoms of the tuberculosis, pneumonia, or any conditions, sarcoidosis. So everything it shows. Okay, so we have to differentiate from those conditions. Then come to the classification. Okay, the lung carcinoma is classified according to the histological type. Okay, so two types: non-small cell carcinoma and small cell carcinoma. So these two types are the type of the lung carcinoma. So in non-small cell, what are the cells are involving? Squamous cell, adenocarcinoma, and large cell. Okay, adenocarcinoma. So these like types are there. Okay, for the malignant tumor, we have a TNM classification. Okay, so TNM. T means tumor, N means nodes, M for metastasis. Okay, tumor, nodes, and metastasis. So tumor is stands for the size of the tumor. Okay, so size is depends on the T0, T1 to 4, like that. Okay, we have a stages. And N for the nodes. Okay, so tumor cell present in the lymph nodes, that is stands for the N. Okay, so in this we have a N0, N1, N2. These are all the staging of the lung cancer. Okay, lung cancer is which stage, the size of the lung cancer is what, and is it affect the lymph nodes or is it not affect the lymph nodes. Okay, so here N3 more extent. Okay, affecting the lymph nodes. Okay, regional lymph nodes. In N0 there is no effect, there is no presence of any abnormal cells in the lymph nodes. Okay, when it is come to 1 to these, so in one small number, okay, very little amount of lymph nodes are affected. In N2 more than this. Okay, medium amount of lymph nodes are affected. In N3 more amount of lymph nodes are affected. Okay, that is what stands for the N. Okay, then yeah, metastasis means the cancer is spread to the other part or not. Okay, if M0 means it not going to spread to the other part. If M1 means it going to spread to the other distant part. Okay, that is the TNM classification of the stagings. Okay, lung cancer is in which stage you can notice. Okay, finally come to the management. Okay, so when come to management, we have both non-surgical and surgical management. In non-surgical we have a radiotherapy and chemotherapy. Okay, so radiation we are giving the uh, IMRT. Okay, intensity modulated radiation therapy. So or we can call it as a photon radiation therapy. Photon. Okay, so already we have a DNA or already damaged in the cancer. So here the photons are having the anti-tumor effect. Okay, and we also have one type, that is a brachytherapy. So in this we are particularly giving the radiation to the one part. Okay, localized radiotherapy is called the brachytherapy. Then come to chemotherapy, we are going to give some of the chemicals. Okay, so in this if the small cell, then we can give the cisplatin and etoposide. Okay, so these are only for the small cell. Okay, if the non-small cell carcinoma is for the small cell carcinoma. If a non-small cell carcinoma, we can give same cisplatin and carboplatin. Okay, with gemcitabine. Okay, these like chemicals we can use. If the person who having the bronchoalveolar carcinoma, it will respond to the gefitinib and eriotinib. Okay, dinib dinib type of drugs. Okay, we can use in the chemotherapy. Then come to the surgical management. Okay, so radio and chemo are comes under the non-surgical. Then come to the surgical management. So if the person does not have the enough functional lung, we can do the wedge resection. Okay, which means we are cut the cancerous part and throw away. Okay, that is a wedge resection. And segmentectomy. We are going to cut the segment of the lung. Okay, and lobectomy, we can cut the lobes of the lung. Okay, and pneumectomy, we can take the whole part, whole lung. Okay, which means one side of the lung will be taken. Okay, that's like a surgical procedure are done for the cancer. Okay, okay guys, in this video we just discussed about the lung carcinoma. Thanks for watching guys. Tata, bye bye.